Good evening, everyone. It's Rob here from Nutridyne Europe. I'm back with Dr. Robert Silverman today talking about how to manage female hormones. For the people that haven't been on the webinar, you'll see on your right-hand side there's a questions box. If throughout the webinar you have any questions, feel free to pop them in there. I'll come back at the end and pose your questions to Dr. Rob. So let's get it started. Dr. Rob, over to you. Thank you.
Thanks so much, Rob. It's a pleasure to be here. We had a little break. We're back at it, and I think we're back at it with a very interesting topic. Managing the female hormones. This is really done by request. So those who are hearing this live or recorded, please feel free to make some suggestions for topics. We have some upcoming topics that we've been debating. We'd like to hear what you have to say. But for today, let's talk a little bit about managing female hormones. Truly at the heart of every woman's health are their hormones, which are always in flux. Hormone balance is complicated, where estrogen dominance is a common hormone imbalance, which can greatly affect how women feel day to day. We will talk about estrogen detoxification pathways, which clearly run through the liver. So we're going to optimize, and I will discuss in detail the 3 phases of estrogen detox and clearance, so I can show you how to prevent the formation of undesirable estrogen metabolites associated with breast cancer, reproductive tract issues, and of course, PMS. By optimizing the pathways, we can also help the ladies with the mood issues, PMS, as I said earlier, weight gain, endometriosis, acne, and of course, without question, gut health. So in improving estrogen detox may help improve female fertility. And not only that, we're going to talk about female hormones in concussion. And I'm also going to start it off with female hormones in reference to the immune system. We're still here. We still have a proverbial health pandemic. Our immune system, if you will, has not gone away. So we're going to cover that in detail. Suzanne Summers said something very interesting. Our bodies are finely tuned machines, and if our hormone mixtures aren't just right, everything goes into disrepair. So some sex differences in immune responses to viral infection. Women have stronger interferon production. Now, interferon is secreted by cells in response to stimulation by virus or foreign substance, but it does not directly inhibit the virus's multiplication. Rather, it stimulates the infected cells and those nearby to produce proteins that prevent the virus from replicating within them. So women also have greater T cell activation, increased susceptibility to autoimmunity like rheumatoid arthritis, multiple sclerosis, and lupus. And all this is caused by an overactivation of antiviral immune pathways. Men, 20% of men are more likely to be hospitalized. They're more likely to require care. And unfortunately, they're more likely to die. Females, interestingly enough, mount a stronger immune response to viral infections than males. The difference is evident in the cells in the innate immune system. Neutrophils are clearly more responsive to interferon signaling from women. So let's talk about the immune system. We've talked about it before, but let's break it down and get a little bit more granular, if you will. So the immune system actually has 3 levels, interestingly enough. 3 levels of barrier breakdown. The first level would be in the barrier would be to prevent entry, and that preventing entry would be the skin and the mucous membrane. There's also stomach acids and digestive enzymes, and thirdly, beneficial bacteria that live in the colon and the gut microbiota. So believe it or not, we're looking at the skin as a barrier and stomach acid and those digestive enzymes. So you're really understanding now, as it gets to the microbiota, why 80% of the immune cells are in your gut. Now, these barriers that we just talked about really go in the innate immune system because they want to break it down versus the innate versus the acquired immunity, acquired also adaptive. The innate immunity is essentially your general defense. We call them Marines here. They're your white blood cells called neutrophils and macrophages, which engulf and destroy foreign invaders and damaged cells. Your acquired or adaptive immunity you get as you age. And when I say age, you don't have to be old. It's sort of child to teenage years. It's quite adaptive. It's a specific defense. It's what you recognize and memorize. So you recognize the antigen or the pathogen. You do so with T cells. Those T cells come from the thymus. They're shown to destroy infected cells. The white blood cells or B lymphocytes, those are B cells. They come from the bone marrow. They actually produce antibodies that target and destroy infected cells. Those antibodies are always remembered by an acronym called GAME: IgG, IgA, IgM, and IgE. The one that we all want to talk about is IgG. The IgG is the smallest one that we have. 75% of the antibodies are IgG. IgG's real secret sauce is its ability to block the docking of viruses on cells, or if you will, in reference to COVID-19, the ACE2 receptor. This slide really speaks to the idea of the immune system fights germs and foreign substances on the skin, in the tissues of the body, and in bodily fluids such as blood. The immune system is made up of these two parts: the innate general immune system and the adaptive specialized immune system. These two systems work closely together and take on vastly different tasks. So breaking down those immune systems, immune responses even more, your natural and innate really speak to the idea of neutrophils, monocytes, macrophages, natural killer cells, and the complement system. Whereas when you're looking at the adaptive, you're looking at those T cells. The T cells are critical for cytokine production, macrophage activation, and lysis of infected cells. So your T cells are really going to determine your cytokine storm, whereas your B cells, which are your signalers, they're going to be your antibody production. So when we take a good look at this cytokine storm, in which it causes a tremendous activation of inflammation and deteriorates the clinical picture, if you have mild COVID-19, you're probably going to have a cough, fever, and some little malaise. You're going to have an increase in interleukin-6 and a decrease in CD4 and CD8 T lymphocytes. However, if you have severe COVID-19, you're going to have a strong cough, higher fever, dyspnea, respiratory failure, a precipitous decrease in CD4 and CD8 T lymphocytes, where you're going to have a massive increase of interleukin-6, TNF-alpha, and IL-1 beta. CD4 is considered a helper cell because they do not neutralize infections, but rather trigger the body's response to infections. CD8 are important for immune defenses against intracellular pathogens, including viruses and bacteria, and for what we call tumor surveillance. So COVID-19 patients who have elevated levels of two certain proteins are more likely to exhibit severe coronavirus symptoms. Number one, interleukin-6 contributes to tissue damage. It's also been associated with increased body temperature, C-reactive protein, and LDL. The dynamic change of interleukin-6 can be used as a marker on its own for severe COVID-19. And the second protein would be TNF-alpha. This acts as an amplifier of inflammation. So the real question for the ladies, and in general, do we have a better answer? And the resounding answer and response is yes. So here we're going to look at the mechanisms of actions of micronutrients against COVID-19. So we have nutrients and we have micronutrients. Those micronutrients are broken down into minerals and vitamins. Let's look at the minerals in this study that were recommended to ingest. Number one, zinc. Zinc is shown to be a strong antioxidant and also halts the replication of SARS-CoV-2. Iron. Iron activates the immune response by helping with the cytokine production. And selenium inhibits ACE2 receptors and antioxidants. Magnesium would have made my list. I do have a slide in some of the succeeding slides to really speak to that. The vitamins that were indicated are vitamin A, vitamin B, vitamin C, vitamin D, and vitamin E. Vitamin A is anti-inflammatory as well as vitamin B. Vitamin C is a strong antioxidant. Vitamin D, with its pleiotropic effects, is an immune modulator and antimicrobial. And vitamin E also helps with the production of interleukin and natural killer cells. When you look at the immune response and making immune suggestions, you really realize that many of these specific aforementioned vitamins and minerals work both in the immune and the adaptive systems. So when you look, and we don't have to break it down, the slide is quite clear. Vitamin A works both with the innate and the adaptive immune system. Vitamin C as well. Vitamin D, zinc, and omega-3 fatty acids. So what's most interesting about the omega-3 fatty acids is that you always hope that they're able to convert to pro-resolving mediators. Unfortunately, the conversion rate is very, very low. Now, having said all that, the only change that you're going to make from the adaptive to immune response, which makes it easy so you can use your several different vitamin formulations, is that you would need pro-resolving mediators for omega-3 fatty acids because they allow for the resolution of inflammation and the homeostasis, between the initiation and the resolution of inflammation. So really, you're seeing, once again, just to reiterate, the innate and the adaptive immune systems are using the same vitamins, minerals, and specific nutrients. Here are some nutrients for COVID-19. Here are some of the highlights. Vitamin D is associated with both decreased rates of infection and improved outcomes for patients. Vitamin C may shorten the course of the disease and decrease severity of symptoms. Vitamin E, zinc, and selenium are known to assist with the recovery of viral infection and may have strong efficacy in COVID-19. Looking at the role of vitamin C, D, and selenium in immune system against COVID-19. Recent studies have shown that vitamin D and selenium deficiencies were truly evident with many patients that had an acute respiratory tract infections. You should also make note that NAC, if it's deficient, you'll see a higher incidence of acute respiratory tract infections. Vitamin D improves physical barriers against viruses. Vitamin D, and we'll have some slides to speak to that, really play a strong role with the gut because they can stimulate the production of antimicrobial peptides. And it's also shown to help prevent cytokine storms by reducing the production of cytokines. Selenium enhances the function of cytotoxic effector cells. Vitamin C, Linus Pauling is smiling, antiviral, always enable you to increase your immunity. By administering vitamin C, you can attenuate excessive activation of an immune response. The ingestion, whether it be injected or oral, decreases viral load when you would use vitamin C. Also, vitamin C reduces inflammatory responses and hyperactivation of immune cells. The University of Bristol research spoke to the idea of ingesting vitamin A, D, and K. It found out that they could bind to viral spike protein and reduce the viruses that cause COVID-19. Linoleic acid also binds to a specific site in the viral spike protein. Taking these supplements, these nutrients, locks the spike into a closed, less ineffective form. So these nutrients are working in a drug-like manner to block the docking of COVID-19 on the ACE2 receptors, therefore allowing for viral shedding. So I mentioned before about magnesium, the potential role of low magnesium status in COVID-19. You'll see a higher incidence of hypertension, diabetes, obesity, cardiovascular disease, stress, and aging. Lower magnesium status, you'll see endothelial dysfunction and a decrease in CD4 and CD8 T cells. These CD8, CD4, these T cells, there's a real story behind that. Essentially, they're memory cells. So our antibodies may last for up to 12 months. As a matter of fact, there was an article that just came out that said the antibodies are lasting up to 12 months post-COVID. But about after that, you kind of hope antibodies wane and they go to memory cells like memory CD4 and CD8. Therefore, when your antibodies stay high too long, they increase your incidence of autoimmunity. There's a direct link between selenium and the outcome of COVID-19. Higher selenium, less incidence of COVID-19, and the inverse is also true. Glutathione, COVID-19 pneumonia, whether it was oral or IV glutathione and or using all the precursors, They actually represented a treatment approach for blocking NF-kappa B, the signal pathway transducer of inflammation, and they were able to address cytokine storm syndrome and respiratory distress in patients who had COVID-19 pneumonia. Green tea, EGCG. There was a study last March, when all this got started. They spoke to the idea of molecular docking of 7 proteins of SARS-CoV, many different nutrients, and several FDA drugs were studied. It was found that green tea is a lead compound that fit well into the binding docks. The conclusion in this study in March 2020, green tea should be explored as a drug candidate for the treatment of COVID-19. One of the surprises that came out in the data over the last year was melatonin and its functions, its multiple functions beyond aiding in sleep. Melatonin can help with immunomodulation, the regulation of mitochondrial functions, anti-inflammatory properties, antioxidant actions, anti-excitatory actions, of course, help with sleep and measurement of the day of length. Melatonin was studied in a Cleveland clinic, one of the most prestigious clinics in America. It was found that melatonin was associated with a 30% reduced likelihood of testing positive for SARS-CoV-2. This really puts it all together for melatonin. Melatonin in this study on June 1st, 2020, was shown to block most inflammatory pathways, most inflammatory markers like interleukin-1 beta, interleukin-6, interleukin-10, TNF-alpha. In addition, it is also shown to block oxidative stress by increasing the reactive oxygen species. Combining, it was able to decrease the cytokine storm while also adding in its sleep issues, or I should say its sedation. They help to be able to get better quality sleep. This study showed that you needed to take, to avoid the cytokine storm, about 20 milligrams. Normal dosage that's needed to help with immune function and sleep is about 3 to 5 milligrams. Curcumin suppression of cytokine release. The results: curcumin blocks cytokine release, most importantly, the key pro-inflammatory cytokines like IL-1, IL-6, and TNF-alpha. By suppressing cytokines, curcumin correlates with clinical improvement models of disease conditions where a cytokine storm plays a significant role in mortality. Alpha-lipoic acid, something that works with the watery and the fat part of the cell. Interestingly enough, in that watery and fat part of the cell, it's also a natural occurring compound. It's cellular coenzyme. It contains multiple antioxidant properties, enhances intracellular glutathione levels, and was also shown to attenuate the increased susceptibility to human coronavirus. Let's look at my immune support supplements. So for me, when I say support, I'm really looking at immune resilience. To me, the idea of immune resilience, and not just the formula, but the idea of immune resilience, your immune system needs to be resilient. You want to support it. When we say balance, we want the innate immune system and the adaptive immune system to be balanced well, but you want it resilient. You want that resilience so you can always have, and this will be for later seminars, immunotyping. So let's break it down. Let's get a little granular. Let's look at some of the products that I would recommend. Well, clearly, vitamin C 1000 complex, 1 tab, 2 to 4 times daily. Immune resilience. I want to detail that because that is your go-to answer, both whether you have not had COVID, whether you've had COVID, whether you've been vaccinated, or whether you've had COVID and been vaccinated. We all know the immune system works by identifying foreign intruders and building a defense for itself against them. The biological process uses specialized cells in the innate and adaptive immune system. The innate cells support a healthy stress response. The other set of cells allow for immune function. Immune resilience contains macronutrients, micronutrients and herbal extracts that support a healthy stress response and thus promote immune and respiratory health. So it's got quercetin, American ginseng, turmeric, elderberry, EGCG, resveratrol, to name a few. Now, what's most interesting is the ingredients in immune resilience are without question what research suggests to be effective and safe, particularly for supporting healthy immune function and respiratory health. So the clinical evidence and research cited showed that the ingredients in immune resilience should, 1, support healthy immune function, 2, promote respiratory health, 3, support healthy stress response, 4, promote cellular health, and 5, support healthy antioxidant activity. Spore ProBio. For me, Spore ProBio is a 3-in-1 formula that without question is a leading formulation to help with gut health. It has Bacillus subtilis. Do you know that Bacillus subtilis is a bacteria found in dirt, is the oldest known living organism? That, when I found that out, that stopped me dead in my tracks. What a great idea to ingest the Bacillus subtilis. Bacillus subtilis is an endospore. The endospore means that it's encapsulated and it's able to get through the body, not die from bile, stomach acids, and pancreatic enzymes, and gets to its desired place in the colon or the large intestine, whatever you refer to it as by. It also has bacteriophages, which make the concept in the gut, which we'll talk about in the future, of a virome. The bacteriophages are specific viruses that attack bacteria to kind of get rid of the bad guys in the house. Almost 100 years ago, when doctors had a choice between what I call nuclear weapons or carpet bombers, antibiotics, and bacteriophages, which only kills one specific bacteria at a time, obviously the MDs chose the antibiotics, but the bacteriophages have now come into popular view because of all that they do. In addition, you have a probiotic. The Spore ProBio comes with a prebiotic, and that prebiotic is XOS. You can take it at lower dosage, no gastrointestinal upset, only feeds the good bacteria, and you always have to have a prebiotic to feed a probiotic. Then you have NAC, you have liposomal bisglycinate, you've got liposomal, my choice, liposomal nanotechnology of glutathione, and you have omega-3 fatty acids of 1,000. So it's omega pure EPA DHA 1,000. So this is a super concentrated and purified fish oil supplement containing an evidence-based dose of key omega-3 essential fatty acids, EPA and DHA. The research has shown that EPA and DHA help with cardiovascular function, clearly immune function, musculoskeletal support, skin vitality, cognitive support. And what's most interesting is that this omega-3 is, for me, I found it to be much better, if I can use the term, than other omega-3 fish oils, because the fish oil and omega-3 supplements, as we all know, are not created equal. Many omega-3 products can provide what we seem to be a large amount of fish oil, but the source is low quality and has negligible amounts of EPA and DHA. This is the actual inverse. We have the right ratio and good quality, clean fish oils, not laced with any lead, mercury, and the like. COVID-19 support. What do you do during the process of having COVID-19? Because we all want to avoid the long hauler syndrome, which we're going to talk about in COVID-19. So product number one, you want quercetin, you're going to use NutriChex. So for me, NutriChex is a unique formula that contains bioactive patented forms of the B vitamins, vitamin B9 and folic acid, as well as key antioxidants that support cardiovascular function, the nervous system, and cellular health. So for me, this is a great product because it also provides detoxification. Brain support. We'll be talking about brain support in a little while, but the idea on brain support was done by our Chief Science Officer, Dr. Rick Mayfield. So brain support is a comprehensive and cognitive and neurological support formula that contains patented bioactive plant extracts from turmeric, green tea leaves, grape seed, rosemary leaf. Basically, the plant extracts in the brain support work to assist in healthy promotion and support of neurotransmitters. Research shows that imbalance in certain neurotransmitters like serotonin and acetylcholine throughout the central nervous system can speed up brain tissue atrophy and cognitive decline. So essentially, brain support also contains something hidden that I felt it was hidden. I'll talk about it in concussion. Ferulic acid, an antioxidant, has been shown to protect against free radicals in neurons. So the takeaway is that brain support supplementation helps support cognitive and neurological function, supports healthy blood and oxygen flow to the brain, helps support oxidative stress. And during the process of COVID, I'm a big believer that COVID-19 is a mitochondrial central nervous system vampire. And that's why I like to support brain support, and especially with the EGCG and the turmeric. Vitamin D3 with 5,000 with K2. And Nervese. Nervese has PEA. We're going to detail that a little bit, but the PEA is interesting in that it is a bioactive lipid that plays a key role in the cannabinoid system, which is responsible for promoting balanced systems, including the central nervous system and peripheral system. So the cannabinoid system helps promote relaxation and healthy nerve function. PEA is produced naturally in every cell of the body in biological response to inflammatory markers. So not only does it help nerve, we're getting a lot of nerve issues within the COVID-19, it's also really shown to help decrease inflammatory pathways. Alpha lipoic acid, we talked about before, zinc, and omega-3 fatty acids. Post-vaccine support. What do you do post-vaccine? Do you just take the shot and walk away? I don't think so. So again, brain support, 4 caps, resveratrol plus, Inflamease plus, a beautiful product. It is a comprehensive herbal formula that's shown to support healthy inflammatory markers in the body. The formula is newly updated with additional health promoting benefits. They have a rich source of phytochemicals. Many of these chemicals are mixed curcumin, ginger, boswellia, white willow bark, hops, devil's claw, and black pepper extract. Sulforaphane, big proponent of sulforaphane, helps with phase 2 of detoxification. Omega Pure EPA DHA 2400. D3 5000 with K2, and my hidden gem, pro-resolving mediators, or PRM Resolve. So something new to banter about with all of you. Neurological symptoms are frequent in COVID-19 long haulers. Long haulers defined as symptoms persisting for more than 6 weeks. 10 most common complaints. 81% of people have cognitive dysfunction. Headaches, numbness, tingling, loss of taste and smell, muscle pain, dizziness, pain, blurred vision, and tinnitus. Many patients report non-neurological symptoms: fatigue, 85%, depression, anxiety, shortness of breath, chest pain, insomnia, blood pressure issues, and about 30% have GI complaints. I believe that the GI complaints are vastly higher than the data in this March 2024 study. PASC, they call it long COVID or post-acute sequela of SARS-CoV-2. Interestingly enough, ICD-10s, there's 6 to 8 in America ICD-10 diagnosis codes for PASC right now. So 6 months after symptom onset in Wuhan, China, the results were 63% had fatigue and muscle weakness, 26% had sleep difficulties, and 23% had anxiety and depression. The study spoke to the idea of testing 207 SARS-CoV-2 infected patients. There was a 12-week period from the symptom onset. An early robust immune response without systemic inflammation is characteristic of asymptomatic or mild disease. Those presenting to the hospital had a delayed adaptive responses and systemic inflammation already evident at or around symptom onset. Viral load does not correlate with the development of this pathological response, but does with subsequent severity. Immune recovery is quite complex. Profound persistent cellular abnormalities correlating with a change in the nature of an inflammatory response. Late immunometabolic inflammatory changes, if persistent, actually were contributory to long COVID or COVID-19 syndrome. I think one of the hidden reasons or one of the hidden issues is glucose, elevated glucose, blood sugar issues. Elevated glucose levels regulate viral replication and cytokine production in monocytes. Glycolysis sustains COVID-19 induced monocyte response and viral replication. Mitochondria is necessary for COVID-19 replication and monocyte cytokine production. Monocyte-derived cytokines drive T cell dysfunction and epithelial cell death. Post-COVID, here are some of the things that you want to look at in post-COVID. Interestingly enough, you're going to have a decrease in fatigue. You want NAD plus, B vitamins, coenzyme Q10, carnitine, alpha lipoic acid, glutathione, zinc, selenium, vitamin C, vitamin E, and if you want to activate your immune system, you want to do so with a cornucopia of different type of mushrooms. People ask me why NMN. Simply put, neurogenesis and cognition, weight control, heart health, anti-aging, strength and endurance, and boost cellular levels. Continuing with lifestyle, everybody, diet. So this pertains to everybody, whether you had COVID or whether you were trying to avoid COVID. In America, 42% of Americans are obese, 75% of Americans are overweight and are obese, and only 12% are metabolically healthy. You guys in the UK over on the other side of the pond are not that far behind us. Please instruct all your patients to pick from a diet that's in low glycemic index carbs, no processed carbs, and consume good fats and amino acids. Improve your sleep. Sleep allows you to have immunorejuvenation of your cells. Exercise is a critical element. I'm a big proponent of low-level laser. It allows for the electromagnetic transfer of energy into the body. And I'm always talking about detoxification because it helps remove toxins from the body. Here is a long haulers protocol. I did not give the products to this. This is something maybe Rob and I can go on and maybe do a Facebook Live for you or a recorded webinar or something like that, because this is the involved, there's multiple steps, but this is what I do in the office in long haulers protocol. I make them adhere to new good gut health, my 7R program, mitochondrial support, cellular health, immune activation, something like immune support. And without question, you always want to manage and modulate inflammation. You want to deal with obesity, blood sugar, and start improving their anti-inflammatory status. Women, breakthroughs in treatment of concussion with women, because the brain is the most nutrient dependent, energy dependent, and toxic and stress vulnerable organ. This really shows it's not the impact to the brain, it's actually axonal twisting when the brain moves around the skull after impact. The forces applied to the brain cause axons to twist and tear. Brain cell death begins to occur. The molecular cascade of events after a mild traumatic brain injury. Kind of showed you what happens. Axons get twisted, they shear, they can tear. You also have membrane dysfunction or excitotoxicity. You have a release of glutamate. The NMDAR site opens and allows, with excessive glutamate, allows calcium to go from the extracellular space into the intracellular space, leading that patient down a path of increased amyloid plaquing. Potassium goes from inside the cell to outside the cell. Once outside the cell, it can provide axonal damage. Piggybacking on that idea leads you to mitochondrial dysfunction, increased ROS and oxidative stress, leading to cellular damage, ultimately leading to apoptosis or cell death. Lastly, you have hypermetabolism of glucose to hypometabolism, all leading to susceptibility to repeat injury. Concussion injury can also cause inflammation or microglial activation. We're going to see how microglial activation is distinctly different with women than with men. That microglial activation leads us to cellular damage, which ultimately leads us to apoptosis. So let's talk a little bit about my Dr. Rob's concussion protocol. It's a multi-system approach where you incorporate chiropractic musculoskeletal work, balance, visual disturbances, laser, and of course, nutritional support. Let's talk about the overview of concussion nutritional protocol for concussion. Number one, ketogenic diet. I love the ketone bodies that it can produce because by producing ketone bodies, they are great energy for the brain. Creatine gives the brain an intense immediate energy to heal cells both in long and short-term amnesia. You want to reduce inflammatory damage? Fish oils. FYI, everybody right here, fish oils are great post-concussion, but they're even more effective prior to the concussion because they help avoid the concussion. So everybody who has a football player where you guys are, soccer where we are, you have to understand that female soccer players, football players, are the #1 athlete that gets a concussion. Every one of them should be prescribed fish oils prior to these concussions to precipitously decrease the incidence as the data has indicated. Boswellia, quercetin, turmeric, ginger. Turmeric is shown to inhibit the microglial activation. You could also throw resveratrol in there. Antioxidants like alpha-lipoic acid, pro-resolving mediators, and choline, which we'll talk about a little bit more in Alzheimer's, is also critical for brain development. Vitamin D is neuroprotective. Zinc is an enzyme that's shown to have positive effects on the central nervous system. Sulforaphane inhibits MMP9 and activates the antioxidant pathway of the NRF2. Magnesium. Magnesium is a great weapon against delayed brain injury. Acetyl-L-carnitine energizes the brain. Glutathione is the body's #1 intracellular antioxidant. It's your master antioxidant. Coffee fruit extract increases the release of BDNF, brain-derived neurotrophic factors. And interesting, in the brain-derived neurotrophic factors, they come from the gut, they go to the brain, and BDNF is a critical element for brain neurogenesis. Taurine, we're going to go into right here. Taurine, interestingly enough, has shown to block this pathway. So typically, with excitotoxicity, glutamate opens up the pathway, calcium goes from extracellular to intracellular, damage ensues. However, glutamate does go through the pathway, but calcium is blocked by taurine. Taurine is very interesting because it protects neurons from glutamate-induced neuronal excitotoxicity by lowering the intracellular level of free calcium. Taurine, again, to piggyback on that theme, taurine is shown to stop excitotoxicity, decrease stress, neuroinflammation, and help with the amelioration of neurological disorders. There's your ferulic acid that we talked about before. It reduces neuronal cell apoptosis and reduces the level of free radicals. Concussion nutritional protocol. Medium chain triglycerides. I'm a big proponent of medium chain triglycerides like C8 and C10. These fatty acids are able to get into the brain and stimulate energy quickly, succinctly, and last for a period of time. Sugar goes up and the person comes down. Your brain is made of mostly fat. It needs fat to optimize its function. Keto salts, or like we like to talk, dynamic keto burn. So basically these salts have these ketone bodies. They also provide the salt because when you shift from carbohydrate to fat as your energy source, when you make that shift, what's most interesting is you lose a lot of electrolytes. So in those electrolytes, you need those salts to get it in, the ketone bodies. The major ketone body that I recommend is beta-hydroxybutyrate. You have creatine. Creatine, again, we talked about it before. Omega-3 fatty acids. Herbalisses. Now, Herbalisses is interesting in that it offers a lot of different herbs, alpha-lipoic acid, pro-resolving mediators, Brain Restore. Brain Restore is a little different because it provides nutritional support for cognitive function. Essentially, these B vitamins are critical for overall cognition. Vitamin D, sulforaphane complex, pure taurine, and liposomal glutathione. Female athletes are at a greater risk for post-concussion injuries than men, and there's multiple reasons why. We're going to go through them. Interesting. Women have a 50% higher risk for concussion than men. The reason is really multiple fold. Number one, women have a tendency to signify an injury quicker than their male counterparts. Number two, women are pound for pound as strong from the waist down as men. But above the waist, women are not as strong. Therefore, their neck muscles are weaker and there's more of a whip, there's more of a shear, and there's more damage done to the brain in the shearing because of the lack of strength in the muscles. And thirdly, something called a withdrawal hypothesis. If a woman suffers a concussion in a premenstrual phase when progesterone levels are naturally high, an abrupt drop in progesterone after injury produces a kind of withdrawal, which contributes or worsens post-concussion syndrome and symptoms. What's interesting is that progesterone is that calming, healing hormone that women need to help their brain respond to trauma. And lastly, gender-related disparity in microglial function. Male microglials function very differently than female microglials. Female microglials, when they get glial cell primed, they have estrogen beta receptors, and they become very inflammatory. This study piggybacks on what I said earlier, in that in the response to injury, microglials cross the spinal boundary from the central nervous system to the peripheral nervous system. In the peripheral nervous system, microglials provide the function of cleaning cellular debris at the point of injury and then returning to the central nervous system in an altered state. Birth control pills have a negative effect on concussion. Concussion during the progesterone phase, they feel less stress, feeling less stress, marker of recovery, higher levels of progesterone, increased blood flow to the brain, and neural protection. So obviously I just made a slight error. Let me retract. The birth control pill has a very negative effect because it's estrogen high. Progesterone gets knocked down. So that is why, I just wanted to be clear, I didn't want to muddy the waters. That is why birth control pills have a negative effect on concussion. So our findings suggest being in the luteal phase right after ovulation of the menstrual cycle when progesterone is highest, or being on contraceptives which artificially increase progesterone, may mean athletes won't have a severe symptoms when they have a concussion injury. Alzheimer's disease. 6th leading cause of death in the US, 7th in the world. Heart attacks increased by 11%. Alzheimer's disease is increased by 123%. 1 in 3 seniors die from Alzheimer's, killing more than breast and prostate cancer combined. 2018, Alzheimer's and dementia cost $277 billion. By 2050, Alzheimer's dementia could cause over $1 trillion in the US. Don't have UK numbers. Somebody in the US develops the disease every 65 seconds. Women's brains, women are more susceptible to Alzheimer's. 60 to 70% of Alzheimer's sufferers are women. Women with MCI are found to decline faster than men with similar diagnosis. Some of the reasons why women are more susceptible: the loss of ovaries, multiple complications during pregnancy, the number of pregnancies, and once again, the evidence about microglial cells function differently in women than men. So the RECODE, what we call the reversal of cognitive decline, totally an excellent approach. I'm almost tongue-tied when I see this, because this has been done by Dr. Dale Bredesen, and Dr. Bredesen's protocol, the RECODE protocol, was not just for stopping Alzheimer's, but he said with the reversal. So with that being said, we're going to choose foods with the GI under 35. This is his protocol. Avoid gluten and dairy. Reduce the toxic load. Include good fats. Avoid processed foods, and eat smash fish. Smash salmon, mackerel, anchovies, sardines, and herring. Incorporate intermittent fasting. Include your ketogenic diet, but eat with intermittent fasting and flexible time schedules. Add medium chain triglycerides. Base everything on a plant-based diet. Without question, test your ApoE4. ApoE4, it signifies that you're most susceptible to Alzheimer's, and try to incorporate, whether you get them endogenously or exogenously, beta-hydroxybutyrate. So here's your anti-Alzheimer's protocol. Include supplements like methylated B vitamins, vitamin C, vitamin D, vitamin E, vitamin K2, resveratrol, acetyl L-carnitine, coenzyme Q10, omega-3 fatty acids, curcumin, pro-resolving mediator, and magnesium. Magnesium deficiency is prevalent in patients who typically eat a low-carb diet because it increases the excretion of ions and many magnesium-rich foods, which are high in carbohydrates. Not only is because of the dietary changes you're going to run an issue in, most people are deficient in magnesium in general. Choline. Choline, a lifelong dietary regimen of choline holds the potential to revert Alzheimer's disease. The benefits of choline supplementation reduce the activation of microglial cells. Microglials, as we all know, are specialized cells that rid the brain of deleterious debris. Although they naturally occur to keep the brain healthy, if they're overacted or overactivated, brain inflammation and neuronal death, common symptoms of Alzheimer's disease, will occur. And choline blocks the production of amyloid beta plaques. It's a very interesting study in reference to omega-3 fatty acids. They are needed to provide brain benefits. 33 participants had Alzheimer's risk factors. 15 participants had APOE4 gene. The treatment group took 2 grams of DHA. The control group took placebo. Research gathered samples of blood plasma, cerebral spinal fluid, and they all tested for EPA and DHA. After a 6-month period, the patients who took omega-3 had 200% more DHA in the blood, 28% more was in the cerebral spinal fluid. Blood plasma levels may not indicate how much is reaching the brain. The conclusion was very simply, E4 carriers, APOE4 carriers, despite consuming the same dose, actually had less omega-3s in the brain. Here is the clinical dosing gem. If a patient has an APOE4 gene, you have to increase their omega-3 consumption by 50%. Lifestyle changes in the RECODE program: exercise, sleep, reduce stress, brain training, resolve inflammation, inhibit new inflammation, remove all inflammatory sources, and without question, heal the gut with my 7R program. Interestingly enough, with the 7R program, Rob can definitely share the protocol for the 7R because we've done it on 1 or 2 previous webinars over the last year. Alzheimer's protocol. Here you go, based on Dr. Dale Bredesen's RECODE. Number 1, dynamic multi-powder. Number 1, research shows that deficiencies in certain vitamins and minerals are major causes of serious disease states and other health complications. So moreover, lack of essential micronutrients can hinder normal growth, repair, and maturation of vital organs and tissues, leading to problems down the road. So the benefits of using a dynamic multi-power may include supporting cognitive function and mood, provide antioxidants to help support oxidative stress, supports vibrant, healthy skin, supports energy and vitality, supports healthy immune function, also healthy gastrointestinal. It's a naturally flavored gluten-free vitamin. I take it myself, and I found that patients, if I may, actually like the idea of powder. So when you get like a dynamic brain restore and a dynamic multi-power and you mix them together, you've now got a really potent, robust, nutrient-filled shake. Of course, your D3 5000 with K2, 1 soft gel daily, pro-resolving mediators, and a very bioavailable form of curcumin. Omega-3 fatty acids, continuing with the protocol, coenzyme Q10, resveratrol, and MCT oils. So lastly, let's finish up with detox. Let's take the deep dive. I wanted to hit this at the very end. I do want to make a clarification before we leave, and I hope to answer any questions that you may have, even if we go over 2 minutes. So the liver has many functions. The liver works in the body like an oil filter works in a car. The thyroid hormone T4 is converted into the more powerful form of T3 in the liver. Regulates stored sugar. This process of stored sugar or excess sugar to fat and turning it actually sugar to fat and cholesterol. Stored sugar in the liver is called glycogen. It is important that the liver can convert this back to glucose effectively. Bile is also a major route of eliminating cholesterol. Bile also carries out toxins broken down by the liver. Bottom line, Improper removal of estrogen can cause an estrogen dominant syndrome. This could lead to PMS, hot flashes, and difficult periods. Let's do this fast. BPA. BPA, synthetic BPA is in children's toys. It's a hormone disruptor. BPA can block the dock so estrogen can't get into estrogen receptors, hence leading you down a path of extra estrogen floating, which leads you to PMS, etc. Also, BPA allows for the promotion of autoimmunity. BPA activates immune response that can persist for at least 3 generations. Here's the example. A woman who's pregnant gets BPA. She has it. She then passes it on to her fetus, which is now developing eggs, which then passes it on to her, that original person's grandchildren. 3 generations BPA can damage. So here is the liver, and we could spend a whole webinar, a whole hour just discussing it. So the takeaways that everybody needs to know is phase 1 and phase 2 should be in sync. Estrogen gets detoxed through the liver, gets taken out through the liver, and will be broken down with bile and passed into the stool. Phase 1 is the first half of the liver. Phase 2 is the second half, where you're breaking a fat-soluble toxin down to a water-soluble toxin. That water-soluble toxin can also be excreted via the kidney. Liver detoxification of estrogens. Metabolism of estrogen does take place primarily in the liver. Promoting favorable phase 1 and phase 2 estrogen clearance is key for female performance and long-term health. Birth control pills, hormone replacement therapy, forms of exogenous estrogen. So what's most interesting is that estrogens, whether you make them or take them, or whether you've been unknowingly intoxicated by them, you should get rid of them every day in a healthy way. So there's some problems with detoxification. Number 1 could be a micro and macronutrient deficiency, therefore not have properly performing enzymes. Genetic alterations lead to poorly performing enzymes. Estrogen elimination is impaired through constipation or increasing beta-glucuronidase, and/or underlying liver or gallbladder disease. So estrogens need to get broken down, and the key to the understanding is estrogens get broken down in the liver. Beta-glucuronidase actually will cleave estrogen, and this is why when you do detox, here is another protocol gem. When you do your dynamic detox kit, you should add a probiotic, because probiotics do not allow estrogen to be cleaved to get a secondary systemic estrogen toxicity in the body. The body's natural detoxification pathways are used to eliminate harmful chemicals and toxins and may benefit from additional support. So here is my detox protocol. We start with this as a standard detox protocol. We use the dynamic detox. You use different, it has different regulating nutrients in the dynamic detox. Just so you know, it's a clinically based grade food supplement containing a comprehensive spectrum of essential macronutrients, cofactors, fatty acids, amino acids, and dietary fiber for supporting healthy detoxification pathways in your body. Dynamic detox actually mixes in easily. It tastes good. It's gluten-free. It's a critical element. The tasting is a critical element to people wanting to take it. You know, if it doesn't taste good, I got to tell you, people aren't going to consume it. I hate to say it like that. It's also got an excellent eating plan and program guide, which is critical for overall patient compliance. We just talked about the probiotics. Probiotics also help with the detoxification. This is a secret sauce time. That this moment enables you to have a better detoxification outcome. In addition, by incorporating sulforaphane. Sulforaphane is great for the NRF2 pathway. Typically, you get sulforaphane from cruciferous vegetables. If you cook the vegetables, you lose the myronase. The formulations are very high-level absorbable forms of sulforaphane. Sulforaphane has shown to help with blood sugar regulation. It also shown to help ameliorate specific obesity, and a nice byproduct of liver detoxification is to decrease body fat and stimulate the NRF2 pathway. The NRF2 pathway, the reason we don't hear about this that much is it's very simple in that there are many nutrients that allow the stimulation of the NRF2 pathway, alpha lipoic acid, curcumin, just to name a few. There are no drugs that can stimulate the pathway. So here it is. Here's my female. We've got a few minutes left. Here's my female detoxification plan, my dynamic hormone balance, liposomal glutathione, and ultrabiotic daily multi-strain. So let's look at the liposomal glutathione. Liposomals are an advanced form of biological nanotechnology to deliver nutrients to your body via liposomes. So fascinating way to get glutathione in, again, protected. Ultrabiotic daily multi-strain is the full spectrum. And now let's take a moment. I think Rob may be actually running a special on this. We were talking before. Let's talk about the dynamic hormone supplementation. Dynamic hormone balance is a comprehensive blend of evidence-based ingredients that support healthy estrogen balance and endocrine function. This naturally flavored formula provides key herbal extracts, bioactive nutrients, isoflavonoids, and antioxidants shown in clinical settings to help balance healthy estrogen levels. Research suggests that the nutrients found in the dynamic hormone balance help support healthy estrogen balance, help support healthy endocrine function, support mood and well-being, help you meet daily macronutrient requirements. So the nutrients in the dynamic hormone balance, actually, if we were to go back several slides, match what's needed to pump the last two, and most commonly the last one pathway in phase 2 of detoxification. There are 6 pathways in phase 2. This really pumps the estrogen pathway. You mix it with glutathione and probiotics, and you have an excellent estrogen detoxification. Add your omega-3 fatty acids, especially omega pure 2400. That's cell membrane health, and of course your sulforaphane complex. We've talked about it before. We're just doing the finishing touches on my book. Nutridyne Europe, Nutridyne America will be promoting it. Please keep an eye out for the Superhighway to Health. As always, I'd like to end with a quote. None better than Sir Oliver Wendell Holmes, who once said, "The mind once stretched by a new idea never returns to its original dimensions." If you have any questions, now's the time. We're going to get Rob on. You can ask them. If you want to get in touch with me or follow me, I suggest Facebook. Every one of my handles is Dr. Robert Silverman, except for Twitter, which is Dr. Rob Silverman. Follow me. We're always posting live videos, and we try and keep it as informative as we can for both patients and doctors. So Rob, if you can pop on, let's see if there's any questions. I think I may have confused somebody on one specific item.
Hi Rob, thanks very much for that. Just while, if anyone else has got any questions, feel free to write them now. Just a quick couple of things from my end. Yes, I'll be running a promotion, which I'll email out to all the attendees on the dynamic hormone balance, 20% off coupon code, which you can use at the Nutridyne Europe store. And I see that we've got quite a few people on from Europe. So I just wanted to give a European practitioner a little update on our situation with Brexit. So we are very, very close to getting set up in Ireland with the distribution centre there. I'm hoping it's going to be another 2 or 3 weeks, and then we're ready to go. That'll enable practitioners from all around Europe to purchase through our website as normal. The goods will then be shipped from Ireland, so the practitioner and their clients will not get charged any import duties, and it'll be much quicker than it has been. So I'd like to kind of thank you all for being so patient with us while we kind of while we adapted and you know, found a different way to kind of supply you guys. But I'll send an email out to everyone about that when it's ready. It doesn't look like there's any questions, so Rob, you might be getting off early. So I'd like to thank everyone for coming today. Dr. Rob, I'd like to thank you for the presentation, and we'll see you all soon.
Thanks so much. Hope to see you soon.